Have you ever felt that familiar warmth on your child's forehead, or seen the thermometer reading climb, and wondered, is this serious? It is a moment many parents face with concern, wanting to know when to manage things at home and when it is time to seek professional advice for their little one. Generally, you should call the pediatrician when your baby under 3 months old has a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. For older children, a fever itself is not always the main concern, but if your child is 3 months to 3 years old and has a temperature of 100.4 degrees Fahrenheit or higher, it is wise to call the doctor, especially if they are also showing other concerning symptoms. For children older than 3 years, you should typically call if their temperature reaches 103 degrees Fahrenheit or 39.4 degrees Celsius. The reason these temperature thresholds are important, particularly for infants, is that very young babies have immature immune systems. A fever in a newborn can be the only sign of a serious bacterial infection that needs prompt medical attention. As children get older, their immune systems mature, and fevers become a more common and often benign response to viral infections. The body raises its temperature as a natural defense mechanism to fight off germs, signaling that the immune system is actively at work. However, the exact temperature reading combined with your child's age and overall appearance helps guide medical professionals in assessing the potential severity of the illness. To help determine if a call to the doctor is needed, start by taking your child's temperature accurately. For infants, a rectal thermometer is the most reliable method. For older children, an oral or temporal artery thermometer can be used. Beyond the number on the thermometer, carefully observe your child's behavior and other symptoms. Are they unusually irritable, lethargic, refusing to drink, or having difficulty breathing? Are they showing signs of dehydration like fewer wet diapers or dry lips? Make a note of when the fever started, any other symptoms present, and how your child is responding to fever-reducing medication if you have given any. Remember, your child's overall demeanor often provides more insight than just the temperature reading. A child with 102-degree fever who is still playing and drinking may be less concerning than a child with a 100-degree fever who is very listless and unresponsive. Additionally, knowing the typical duration of a fever, usually 2 to 3 days for most viral infections, can help you monitor their progress. Trusting your parental instincts is also a key factor. If something feels off to you, it is always appropriate to seek medical reassurance. By understanding these guidelines and knowing what other signs to look for, you can feel more confident in managing your child's fever. This knowledge empowers you to provide timely care, ensuring your little one gets the right attention at the right moment, whether that means comfort at home or a reassuring call to your trusted pediatrician.